Good morning, good afternoon, good evening, and welcome to The Nest. It's May 21st, 2020, and we are streaming live with participants from North America, Europe, Africa, Asia, and around the world. For those of you joining for the first time, I'm Jim Chu in San Francisco, California, and the goal here on The Nest is to connect entrepreneurs in frontier markets with angel investors worldwide. During the lockdown, we stream weekly on Thursdays, and all episodes are recorded and available on our website, findthenest.org. Today, we have a first for The Nest, an all-female angel investor panel, 3 very well-accomplished angels from Europe and Africa. They'll be hearing pitches by companies from Bangladesh, Kenya, and Uganda. In fact, our first company from Uganda. We'll hear all about them in a minute, but first, let's cover some technical tips for today. You probably noticed that you are automatically muted when you entered the meeting. Please leave yourself muted unless you're speaking. But we do want to hear from you. We definitely want to hear from you. This is an interactive forum, and we've left it open for questions and comments from all of you in the audience. So please use that chat box. Make comments, ask questions during the show, but please keep it clean and make some investments. In the meantime, please use that chat box to introduce yourself. Tell us who you are, what you do, which country you're from, and why you're here on the show. All right, let's get going. So first of all, let me introduce myself very quickly. My name is Jim Chu, and I'm based here in San Francisco. I invest in startups worldwide, both on a personal level and with our company Untapped. Our mission at Untapped is to support entrepreneurs and drive innovation in frontier markets through investment and technology. So if you're interested in innovative ways to invest in frontier markets, such as Africa, please hit me up. I'm at jim@untappedinc.com, and you can always find me at LinkedIn. All right, now over to the important folks in the room, our angels. Sarah, would you like to start first with introductions?
Very happy to. Thank you for having me, Jim. My name is Sarah Dusick. I'm the co-founder and managing partner of Enigma Ventures, which is a venture fund established last year in 2019 to focus on investing in women entrepreneurs in Southern Africa specifically.
Great. Ijoma?
Hello, everyone. Hi, Jim. Good morning, afternoon, or evening to all, depending on where you are. My name is Ijoma Agbuti-Obatoyinbo. I run the alternative investments business at FBN Quest, which is part of the FBN Holdings Group, one of Nigeria's largest financial services conglomerates. I've spent my career over 20 years now in alternative investments in both emerging markets and Western markets. I have a very keen personal interest in looking at and supporting and mentoring and investing in small businesses in Africa, particularly poised for growth and impact.
Great. Thank you. Welcome to the show.
Thank you, Jim.
And we have a returning angel from the UK, Gita. Oh, and you're on mute.
Thanks very much. It's good to be back after a week. I am the CEO and founding partner of Equalitas Capital Partners. Like Ijoma, I've spent almost my entire career in the investment space, more on the GP side in terms of growth capital, focused on emerging markets, Latin America, Sub-Saharan Africa, and Asia. And over the course of the last year, I've looked at investments from the other end of the spectrum. So over the course of the last year, I've made over 10 investments in earlier stage businesses on the continent, predominantly in Africa. That said, the focus that I have is looking for businesses which have an alignment in terms of a return as well as an intended outcome from a development impact perspective, of which there's plenty. And I think all 3 businesses from today hit those criteria.
Great. Well, thanks for coming back, and thanks to all three of you for taking the time to be on the show. And it looks like we have the results of the poll, so I'm going to end that and show that. So we have quite a broad spectrum of folks here. We have a number of folks from North America, as well as a number from Africa as well. Great. Thanks for taking part in the poll. And now on to the presenters. We have Silvana from Bangladesh. We have Lucy from Kenya, and we have Derek from Uganda. I think I saw all of you on there. And just a quick rules of the game. You'll each have 5 minutes to present, and then we'll have another 10 to 15 minutes for questions and discussions before we hopefully make some deals. So first up, Silvana. You're here to tell us about affordable family healthcare in Bangladesh. So over to you. I'm going to stop sharing my screen and feel free to share yours.
Thank you. Well, I guess let me just quickly share my screen. It's wonderful to be here. I'm Silvana Sinha. I'm the founder and CEO of PRAAVA Health. I'll just tell you a little bit about myself before I jump into the pitch. I am a Bangladeshi American lawyer. I actually was born and raised in the United States and moved to Bangladesh for the first time to start my company almost 5 years ago. I am a lawyer by training. I worked in international law and development for most of my career, including at big international law firms, at the World Bank as an advisor to then candidate Barack Obama, and was kind of chasing impact in my life and my work, and was visiting Bangladesh for a family wedding several years ago, and my mother was hospitalized for a basic appendectomy. And this was we were in the VIP suite of one of the best private hospitals in the country, but despite that, the surgery was botched, and she had tremendous complications after the surgery. And we ended up having to airlift her to Bangkok, where she had another surgery, and a year later, another surgery in the United States. She's better now, but this was my first up-close experience of the limitations of the healthcare system in Bangladesh. And I was not a healthcare person, but I had always worked in emerging and frontier markets. And I was at this moment where I was kind of craving impact in my life and my work. And as someone who covered these markets, I did see that it was a really interesting moment in Bangladesh's growth trajectory. And there was appetite and demand for quality healthcare. And so I thought that maybe there was something I could do to try to address that problem. I don't know how much you guys know about Bangladesh, but it's one of the fastest growing economies in the world. It's been growing at 6 to 7% plus for the last 15 plus years. And it was 8% last year. And even this year with COVID, the World Bank has reduced its projections to still 5.3%. So, it's definitely one of the most exciting frontier markets, I think, that often gets overlooked and people don't realize has more than 160 million people in it. And so, that growth has really been fueled recently by this robust middle class that has an increased appetite for quality healthcare. As I think many of the judges are well aware, what we know is that as economies grow and as GDP per capita rises, demand for healthcare and quality healthcare services rises disproportionately. And Bangladesh has been no exception to that. We have an 11% CAGR for the health sector over the last 15 plus years. And we have basically, initially I observed that the interesting thing about Bangladesh is that it's doing really well on social development indicators. Life expectancy is 74 years, and really on overall, Bangladesh is doing better than most countries in the region. But as we have this growth and this progress, you have many people graduating into the middle class, and there really aren't any options for the middle class in terms of quality healthcare solutions. So every single day, you have up to 2,000 medical visas being issued to travel to India. And so actually, when I first started out, I had this hypothesis that quality diagnostics was the issue because I knew there was only one internationally accredited lab in the country. But when I learned that all of these people, middle-class people, were traveling to India, I actually went and stood outside the Indian embassy in Dhaka and talked to the people who were in line for the medical visas and asked them why they were leaving their country. And despite the fact that I had this hypothesis about quality diagnostics, when I asked them why they were leaving their country, none of them mentioned the issue of diagnostic error rates. They all said, we just don't trust the system. The doctors in Bangladesh don't spend any time with us. They don't answer our questions. They don't even look at us in the eye. And in fact, the average amount of time doctors spend with patients is 48 seconds. And when I tell Indians this story, they often laugh at me because they feel the same frustrations with their system. But the average amount of time doctors spend with patients in India is 2 minutes. So these are the margins we're pushing up against. So I realized that there's this huge trust gap. And I knew because of my work in international development that there are more people dying due to lack of access to quality healthcare than lack of access alone. And so what we've built basically is a fully vertically integrated outpatient care model that's grounded in quality and affordable care for the middle class of Bangladesh. So you can see a picture of our flagship facility on the left side of the screen there. It's a 10-story building in downtown Dhaka. The first 6 floors are all patient-facing, centered around family health, family doctors, women's health, pediatrics, dentistry, as well as allied health providers, nutrition counseling, psychological counseling, health coaching, and physiotherapy services, as well as visiting specialists in the most common outpatient specialties. So cardiology, gastroenterology, basically everything you need in an outpatient setting, you can access at PRAAVA. We also have our own in-house pharmacy that sources directly from manufacturers. So we eliminate the risk of counterfeit drugs, which is true of about 10% of the drugs in the market. We also, on the 7th floor, we have an in-house lab that's set up according to international standards. We have 6 labs actually, and the first molecular cancer diagnostics PCR lab in the country. In fact, I'm very proud to share that Bangladesh was the first private lab that started doing COVID testing in Bangladesh last week. So we've been very busy at PRAAVA with COVID response, as you can imagine. Everything is fully technology enabled. We've brought Bangladesh's first fully integrated hospital information system, which features the first patient app in the country where patients can access their medical records from their phone. This is a country where patients carry their medical records around in bags. And so through our app, basically, you can receive your reports on your app. You can book appointments. We've started doing video consultations. By the end of the year, you'll be able to book online pharmacy delivery from the phone. You can already do it, but not from the app, but you can do it through WhatsApp right now. So we're very excited about the technology aspect, and having firmly built this brick and mortar healthcare system, we believe we're uniquely positioned to now make investments in digital health technologies to really increase access to our quality services. We opened our doors 2 years ago. We reached operating break even in 10 months. And so we're raising now to expand the network. Basically, the concept is a hub and spoke model. The hub is the building you just saw a picture of. That's the 10-story building. The spokes look more like, in an African context, a Penda Health or a GP's office in the UK or Fullerton Health in Asia. 3,000 to 5,000 square feet. You can see a family doctor. You can maybe get an x-ray. You can have your blood drawn, but the blood gets sent to the hub for analysis. And for anything more advanced, you get referred to the hub. So that's broadly the model. I'll just pause there and jump to our COVID response, which we've been, as I mentioned, quite busy. COVID came to Bangladesh basically in mid-March and started to escalate at that time. Although we're still toward the beginning of our journey, the curve continues to steepen every day, sadly. Immediately what we did was we rolled out a free hotline for our patients. We partnered with the government, and we're the first private provider to support them with their 333 hotline. We converted in-clinic appointments to video consultations immediately. By the end of March, we were doing that. We have doctors in our referral network who don't sit at PRAAVA. We also brought onto our video consultation platform. We rolled out online pharmacy delivery. We were already doing home sample collection for labs. We expanded that from the geographic area around our flagship facility to across Dhaka city to serve the entire 18 million residents of the city. And then, as I mentioned, we've launched the COVID screening testing just last week, which has been a real honor for us to do and to serve our community in this way, but has also resulted in tremendous demand for our services. Our call center is experiencing 10x the traffic that we received before. We have a number of corporate offerings, dedicated COVID-19 hotlines for our corporate clients, virtual trainings on raising awareness on COVID, also helping people to understand how to keep their home and office clean and functional during this time. We launched a dedicated COVID-19 website. I just want to talk a little bit about our tech for a second because I'm really excited about it. We launched a Facebook chat bot that patients can access to access information about COVID. We launched our proprietary risk screening tool where patients can self-assess their risk. And we have designed a product whereby patients and doctors can manage COVID positive patients who don't require hospitalization outside the hospital setting. As an outpatient provider, we believe the value we can add to the system is by preventing patients from flooding the hospitals in Bangladesh. This is a country that only has 500 ventilators for a population of more than 160 million people. And so this tool basically allows patients and doctors to communicate, patients to enter their biometrics, and based on the biometrics they enter and the frequency of their reporting based on their risk profile, doctors can assess whether they need to talk to the patient, how frequently they need to talk to the patient, what they need to teach the patient to do to manage their symptoms at home, and to help the patient to make a decision about if and when to actually take the risk of leaving their home and going to a hospital. So that product is already live with the doctor community, and we're partnering with the government on a pilot right now. So I've spoken for a little while. I'll pause there, and I'm happy to jump into any questions you guys might have.
And perhaps somewhere in between the questions and the end, love to hear your ask for the nest today.
Sure. Yes. I'll just pull that slide up while I wait for your questions.
Okay.
Oh God, where did it go?
Then over to the angels. Any comments or questions?
Maybe I'll kick it off. Silvana, thank you so much. That was great, and well done to you, because it sounds like you've really ramped up and had some success in a short period of time. So well done. What would you say is really your market? To me, on first blush, it looks like quite an upscale service that you're a service that you're providing. Can you comment on what your target market is, and maybe a little bit about affordability of your service as well?
Sure. So basically, we sit firmly between the overpriced the overpriced private facilities and the overstretched public facilities. So actually, if you don't mind, I do have a slide on pricing. So basically, again, we're there to serve the middle class. We estimate that our target group earns anywhere from about $350 a year all the way to $350 a month all the way to $2,000 a month. But the interesting thing about healthcare, as I'm sure you know from your experience in other markets, is that people will pay to access quality care. And so increasingly, we're seeing more and more people from all walks of life. And I feel really heartened. I mean, we see more and more people who enter the facility without wearing shoes. And so the interesting thing about the video and the telehealth aspect of it is it's allowing us to also serve a different segment of the population. So in addition to video consults, we've rolled out telehealth consults whereby patients can call us. Patients are really price sensitive in Bangladesh. So one of our offerings that I didn't get to mention is we have an insurance type product whereby you pay a flat rate for unlimited access to services. And so that price point used to start at about $70, and we did some research and patients wanted a cheaper product. And so we rolled that out in January, and we saw a 40% uptick in sales of that product. So we're learning about the pricing. We like to say we're priced at market, and we really do offer more value for money. But when you have a quality product, you end up increasing efficiency in the system in the long run. I mean, this is a country where many people were getting their blood work done at 4 or 5 different facilities to validate that the result was accurate. And so with PRAAVA, you can come to us. It might be slightly more expensive. It's definitely more expensive in the public system, but you can trust that the result is accurate.
Savannah, I would echo the congratulations on the incredible vision that you've got and everything that you've done to date. I would love to know about your growth strategy. You talked about you've got your central hub. I'm understanding that you're raising money to try and create more satellite, sort of like GP-like or urgent care in the US type models to sort of work around your hub. Talk me through some of the economics around what you're trying to do next in terms of adding more facilities in addition to your existing hub. Talk me through some of that.
Sure. So this is basically the trajectory through 2027. This is the kind of revenue projections that we have. 2018 and 2019 are actuals. 2020 was our projections. We're slightly downsizing that due to COVID, but we don't think we'll be too far off of that. So basically the idea is that we want to expand organically within Dhaka in the next 3 years with additional spokes and one hub on the other side of town. And then in the year after that, we want to expand to Chittagong, which is the second largest city in the country. So we really are focused on the urban middle class. We have 1,000 Bangladeshis moving into the cities every day. And that's the segment of the population that we're really focused on. I want to just mention one more thing, and that's that the middle class is being left behind in all of these economies that are growing fast. And so a lot of impact investors don't necessarily think of us as an impact play. I think we very much are an impact play. I think that the growth of our economy is dependent on a healthy middle class. And I think that's a really important part of what brought me to start this company. And I think the quality piece is also a really important narrative. I mean, I have one of my advisors often says, you know, the person in Bangladesh can't walk 5 steps without tripping over an NGO that's trying to help them. But that doesn't mean the doctor they're going to talk to is applying appropriate protocols to the care, or that the lab that's analyzing their results is going to give them an accurate result.
And just on that note, there's a question from the audience. What percentage of the total population is considered quote unquote middle class in Bangladesh?
Depending on how you cut it, 30 to 40%.
Thank you.
So to get back to my question, Silvana, talk me through.
BCG has a great report on it actually that I can share if anyone's interested. Sorry to interrupt you. Yeah.
Talk me through the financial metrics of one new location, expected spend, expected revenue driven by one location, and expected EBITDA output from one new location.
Sure. So basically you have here the unit economics of each unit that we've modeled. So there's the hub, there's the spoke, and there's the pharmacy. So as mentioned, we reached operating break even for the flagship hub in 10 months, and we expect each spoke to achieve that in a similar trajectory of time, which is probably actually conservative because we believe we now have a brand value in the city. And what you see with models like this is usually that each subsequent unit reaches operating break even more quickly than the one before it. So the investment cost for one hub is $5 million. The investment cost for a spoke is $500,000. Although we do have a number of different spoke, different spoke models that we'd like to experiment with within the first 10. And so the range of equity investment for that starts at actually $250,000 and goes all the way to $500,000. And a lot of that depends on the availability of real estate, but also the types of folks we want to put in different communities. So for some communities, for example, you might want to focus more on physiotherapy services. For others, you might want to focus on mother and child health. Yeah, but this is the one that's modeled here is the kind of fanciest spoke version that has a couple of sonograms, a couple of x-rays as well. And that makes it a little bit more expensive. The hub has a payback in 5 years. The spoke has a payback in 3 years. The unit economics of the pharmacy, you can see I think it's quite conservative. The government sets the MRP, the manufacturer's retail price for the pharmaceutical products. And so this is based on one pharmacy, but as you expand, obviously you achieve economies of scale and you have more leverage with the distributors.
So you've said your EBITDA number of 67% in year 5, 67% of revenue?
Correct.
Okay. And you're expecting your revenue to be 2.04 million in year 5?
For one
spoke?
Sorry. For one spoke, it's 3.8 million.
Okay. Of revenue, okay.
Yeah, of revenue, yeah.
The cash flow, net cash flow 2.04.
Got it. Okay.
Yes, that's right.
Silvana, congratulations. This is, I recognize this model, by the way, and much of what you've got in the deck and much of what you've spoken about, we can definitely see being very similar to issues that we have across a lot of sub-Saharan Africa as well, by the way.
Sure.
Having been part of the team which made an investment in Apollo Hospital in Dhaka, years ago. I'm relatively familiar, though my knowledge of Bangladesh has reduced. And
I know you're at abroad, right? I saw your profile.
yeah, this was an investment we made as Aureus Capital, so it was a really old investment that we made.
Sure. I know Dr. Rajiv's, who used to sit on the board. I don't know if from abroad. Um,
He's a fantastic,
Now,
fantastic
yeah,
guy.
he's great.
Absolutely.
Yeah.
So Silvana, when I say I broad brush, I recognize this model. I recognize it for a number of reasons, including you're having to build your own infrastructure for everything. And that just makes this investment look very different to most early stage investments. And so part of the immediate thought I had, but then I quickly figured it out, was you're going through a funding round right now, right? You're raising over $10 million. So the ask for the nest today is for a very specific thing. It's a $25,000 ask, is it not?
Of the United States with regards to conflict of interest. So even if the IMF,
I think someone else might have their volume on.
Oh,
fired, Joe Biden had no business being the one firing him because he had a conflict of interest of his son was on the payroll of a company being
so I have basically three potential asks. So one is on the COVID testing front. We're immediately seeking $314,000 to triple our capacity to do tests. We currently have a capacity to do 288 tests per day. We're booked out already, quite far out. And so we'd like to triple our capacity to do 864 tests per day. So that's the immediate ask. We've modeled that, the ROI on that, we expect by the end of the year, to be honest. And after the COVID passes, we can use those machines to do infectious disease testing, which we already have demand for, because we already do the molecular cancer testing. If we are not able to raise the 10.6 million, and we're well aware of the fact that it's not a good time to be asking anyone for 10.6 million, given where markets are right now, the bridge that we're looking to raise would not be for expansion, but would be 2.5 million to allow us to get the hub to operating break-even or to cash flow positive, to cover the corporate expenses, which are not currently covered by the revenues, would allow us to continue to invest in the tech and roll out that version of the patient portal that has video consults and online pharma delivery in it and other features as well. And also allow us to finally invest heavily in marketing, because we've been very proud of the growth we've achieved, but frankly, it's been mostly organic because we haven't had a lot of cash flow to devote to marketing.
Okay, I understand. So the challenge that I was looking at here was trying to differentiate between the various rounds that you're raising right now. I know you're looking for debt as well. And I do understand this because you're trying to build the infrastructure, you're trying to build the technology on the go as well. Could you tell me a little bit about the technology actually? I noted that you had a proprietary hospital information system, management system that you had developed. Is there a reason?
So we didn't, sorry.
No, please go ahead.
Sorry, we didn't develop that. We purchased that. So we took so many risks on day one, as you point out. We took so many risks on day one. I said, I don't want to take the risk of building software. So we purchased a Dubai-based vendor solution that was a fully integrated 16 module solution. And we've learned a lot from that experience, but we basically now are in the process of transitioning onto a software system that's based on BahnMe, which is an open source EMR platform that can be customized, and building onto that to really make sure that it matches the patient experiences that we're trying to create in Bangladesh.
Okay, fair enough. There was a particular sentence in your deck, which is a first of what I've seen after the COVID pandemic has hit, where what you said is, this crisis has accelerated your focus and is allowing you to come back stronger post-COVID. And I know most healthcare facilities right now are stuck in a bind, and I'd love to get your sense of where your business is feeling this, or whether that you're feeling this at all. With a partial lockdown in most of our countries, we're finding a lot of healthcare facilities are struggling to have patients able to come to them. But at the same time, and so you have liquidity issues immediately. And at the same time, you also have an issue because if and when the pandemic results in greater degrees of people being infected and needing hospitalization, needing exactly these resources, there's going to be a rush for these services. So I'm wondering how you're managing this here. So I noticed most of your income seems to be coming from your lab work. So is there a pivot to be made here to have a separate brand altogether that just is a lab business? Because the fundamental cost structure of a lab business is very different to that of a hospital, and the repayment rate on any sort of investment on either of those just looks very different.
Right. Well, so I'd love to talk that through with you, to be honest. I mean, we're in the process of figuring all of that out right now. So basically, immediately during this period of time, we're really focused on the three channels we're focused on are telemedicine, which is a feeder into the lab. Secondly, home sample collection for the lab business, which, as I mentioned, we've rolled out across Dhaka City now. And thirdly, the online pharmacy delivery channel. And so we certainly are facing liquidity challenges. We didn't see much of a drop in revenues in the month of March, but we definitely were affected in April. May, we're back on track, mainly because of testing, to be honest with you. And we do think that the testing is going to help carry us through to some extent. But of course, there's a reduced demand for, optional healthcare services, elective healthcare services. And many people are postponing dental surgery or whatever they might be coming to PRAAVA for otherwise. And so there is a need to pivot. We hope that those three areas are going to help to fill that in addition to the COVID testing. But, we're kind of figuring that out right now. I think by the end of June, we'll have a better sense of what's really picking up and what direction we might want to try to take things during this time. But I stand behind the sentence that we included in the deck, which is that if we can survive this moment, I know we're going to come back stronger than before, because all of the activities that our team, I mean, I'm so proud of my team. I have a really amazing team, and you might be happy to hear that it's 40% female-led, female management team. And they've been working like crazy to really serve our patients in every single way. And I think that those activities have really, really presented our brand in a really favorable light. There are a lot of people who know about PRAAVA who never knew about us before. And I think what we also know, and we don't know it, I guess, but there are a lot of projections that post-COVID preventive diagnostics and preventive healthcare spending is going to increase.
Okay, thanks very much.
There's a question from the audience as well. Do you have challenges recruiting, from Jim Davidson? Do you have challenges recruiting talent for hubs and spokes, doctors, nurses, etc.?
Thanks for the question, Jim. So the first facility, the flagship facility, to be honest with you, so when I did this pitch, 4.5 years ago, when I was trying to raise money, when I met Jim actually around that time, and I thought that human capital was going to be our #1 challenge. And I still think if I can bring the money in to build out all of this infrastructure, that human capital will be our #1 biggest challenge. But it wasn't as difficult as I thought it would be. We've actually been really lucky to attract some incredible professionals for the flagship hub. I mean, we have 2 NHS trained doctors on our family health professionals team. My senior medical director has 40 years of experience in quality management from all over the world. My chief innovation officer is one of 5 actuaries in the country. So we've been really lucky. However, as each subsequent facility, you have a smaller and smaller pool to pull from. And certainly Bangladesh faces a constraint in terms of quality doctors, quality nurses, quality technicians. In fact, the nursing and technician shortage is even worse than the doctor shortage. And so in the future, if you look at our 10.6 million raise, there's a lot of investment under SG&A that includes actual investment in training. We've already got partnerships with Harvard Medical School, but we'd love to deepen those relationships so that we can invest more heavily. And there's a whole other business model for someone to write on training institutes in Bangladesh, because I think there needs to be more investment in that area as well.
Gotcha. There's also a question from Harsh from India, who's asking about hurdles in developing the infrastructure, whether you're facing local issues with regulatory authorities in generally developing the infrastructure. And Harsh,
so we haven't faced challenges.
Representing
Sorry?
your question correctly. Go ahead, please.
So it was hard to find the real estate. I will say that it was difficult for us to find the flagship facility. It took longer than expected, and then it takes a long time to renovate a 10-story building. Although we did that in 9 months, And I'm quite proud of that fact to have done that in 9 months in an emerging market. My closets in my apartment in New York City took 6 months to do. And so we've been able to overcome those things. We haven't faced tremendous challenges so far, knock on wood, in terms of regulatory approvals. And, you know, I have to say that's been manageable by us. There's always little things. I mean, we had, Jim might remember, we had a ribbon cutting ceremony for our flagship facility on August 24th, 2017. And we planned to open, but and we kept telling the landlord, our agreement with our landlord negotiated that they would connect the power line that we needed, because we have so many machines. It's more power than a traditional 10-story building needs. And, but they weren't doing it. And so then I think they didn't believe we would be ready on August 24th. Then lo and behold, we were ready, and we didn't have enough power to run all the machines. We only had enough power to run the lab and 2 floors. And so we launched we had a soft launch basically, and then they weren't connecting it. And then October came, and we found out basically that, basically they didn't have the funds to do it. And so if they had told us that earlier, we would have managed it. So basically what we did was we're like, fine, let's deduct it from the rent. And we hooked it up ourselves within 2 months. So we have a really scrappy team, and we have good resources and networks in the country that we can turn to, you know, if we need to, for support. But so far we haven't had to lean deeply on those networks.
Another question from the audience: is there a reason you're raising equity for CapEx over debt?
So we're raising both equity and debt. Just to be clear, we do have an existing 3.5 million debt facility, which has been primarily used to procure the equipment. And so for the next raise, there's 10.6 million in equity and an additional 3 million in debt for the equipment primarily, which we think is an appropriate debt to equity ratio for a business of our size and in our industry.
Gotcha. Any additional comments or questions from the angels? Otherwise,
Yeah, I just have a question there, and a comment. The question is: have you approached, especially given that you've worked for the World Bank before, have you approached IFC? Because this, to me, seems like it should be straight up their alley. Not that anything is ever straightforward.
Right. We can have another conversation about that offline. I have approached IFC. So here's the challenge we face with our fundraising. Number one is Bangladesh. It's not a very sexy investment destination, even though I think it should be. There's all the reasons that it should be, but it kind of falls between the cracks of Southeast Asia and India and Pakistan. Number two, the investors who understand our business, like IFC, like Abroad, like TPG, we're too small for them. So IFC, the process that we went through with them, we ended up falling between the cracks. We were way too small for their traditional health team, and their tech and their venture team is focused on tech, pure tech. And I just had another call with them yesterday. It might be that COVID changes that, and I hope that it will. But yeah, it's been, I think that overall, that described those 2 reasons have been my biggest challenges. There isn't my next venture, and maybe I'd love to get your perspective on this. Is I want to start a venture capital firm focused on frontier market healthcare infrastructure, because that fund does not exist for Bangladesh or for markets similarly like Bangladesh across Asia. It exists for India, it exists for Indonesia, it exists for America, it even exists for Kenya, but I don't think it exists for Bangladesh. And there's a void. And when we think about what the world needs and what Asia needs, and the crisis, this COVID crisis has highlighted it, we don't just need another app. Apps can only solve so much of the problem. We need infrastructure.
I'm with you on that.
And yeah,
Savannah, I'm absolutely with you on that. And I thought I wrote a fund proposal for exactly that in 2013, but that's a whole other story.
Oh yeah. Oh, cool. Would love to hear about it.
That said, the comment that I was going to make is starting a healthcare business is extremely tough, and I agree with you. It is tough to tech your way through that, especially in markets which are facing the kind of constraints that Bangladesh and many of our markets are facing. So part of the comment that I was going to make is I disagree with some of the folks who may have been telling you this is not an impact investment. This is. The packaging and the articulation of this is really important, because there's a difference between an impact investment, which is an investment at the end of the day, as opposed to a philanthropic engagement, which is not usually in the form of an investment. So I think being able to craft that story and being able to bring that out is going to hopefully help. But like most things in life, it's helpful to find the right investors who align with your strategy, but also align with your vision. And having visited one of these tourist type hospitals in Bangkok, quite by accident, what I found was two of the largest communities that they were serving were from Ethiopia and were from Bangladesh. So I know that there is a viable market, and especially in times like this where people can't fly out anymore for their healthcare. I think post this crisis hitting, everyone everywhere is reconsidering how important it is to have access to reasonable healthcare wherever you are.
Thank you. No, well, yeah, I'd love your thoughts on, I don't think we've done a great job positioning this as an impact investment because we had gotten some really clear indications that people weren't going to consider it that early on, but I've not revisited it. So yeah, it's a great point.
I would personally, Savannah, don't think worry about positioning it as an impact investment. Position it as a great venture. Don't worry about impact. This healthcare is impact, period. So, focusing on great unit economics, great potential revenue streams as a great venture investment that happens to be in an emerging market is the better positioning, because investors like making money, and you demonstrate a clear path to great returns whilst doing an extraordinary thing in a market that's wide open and needs this kind of provision. You'll raise the money.
Thank you. I hope so. I think so. I think we're going to get there. I don't know how exactly, but would love your advice on that as well.
And I believe we have a current investor in PRAAVA in the audience as well, Jim Davidson. Jim, would you like to make any comments? I know you've been with PRAAVA for quite a while now as an investor.
Well, I mean, yeah, I mean, as Savannah mentioned, we met a while ago. I knew and worked with her cousin, another investor, and I just say I'm very impressed with the progress. I mean, from just sort of maybe we'll be able to open a single facility in Bangladesh to this hub and spoke model. I can see how that will definitely work in Bangladesh, and I totally agree that this is a market that gets sort of lost in between. I spent a good 2 weeks in Bangladesh with a good friend driving around. There's so much that can be done. There's so much opportunity, and this issue of if we're not focused on the lowest tier, the poorest of the poor, it's not impact. There's a corollary to that, which is that is it really fair to walk away from the middle class? And I think this whole theory of change around empowering and keeping a healthy middle class and having that spread out to help build out all of Bangladesh makes a ton of sense. So congratulations. And I've contributed a little bit to this round, in full disclosure. Try to do
We're lucky to have you, Jim.
Yeah, so thanks for all the hard work. It's really, really appreciated.
Thank
you.
Great.
We're running a little short on time, so I'd like to pass it over to the angels and hear what they think about the investment.
Just a quick one from me. Again, Savannah, well done. A couple of things. I certainly hear what Sarah is saying, that this investment should be evaluated on the basis of just its potential return metrics and potential revenue generation metrics. Unfortunately, I think it's really a failing on the part of investors that there's a tendency to put different types of investments and assets into different boxes. So, there will be a number of VCs that might look at what you're offering as more of a social infrastructure type of investment. And I agree 100% with what Geeta said about the fact that, yes, technology is critical and certainly critical for certain aspects of the market, but core infrastructure, technology is there to enable that core infrastructure. So we have to get that right. So I'm glad you're landing on that. But my main point would be, unfortunately, just the way the investment landscape is structured, you may have to target groups that are very specifically looking for some of those social infrastructure types of projects in certain markets. Great job. A little bit on the slightly, larger size for me personally, And I love that we can take some of what you're doing and maybe channel some of that thinking into some African markets as well. I have an organization in mind that I'm associated with that I would absolutely love to get you in front of. So we can probably swap some emails offline. But
That
I
would be
don't.
wonderful. That would be wonderful. We're bringing in even small amounts right now, so would be happy to discuss as well if you're interested.
Sure. We can talk a bit more. For now, for me, it's not a table pounding yes on the call, but we can certainly chat more, and I would certainly love to get you in front of a couple of folks.
Sounds good. It's great to meet you. Thank you.
And on my side, Silvana, I think this is a really interesting model, and it's a market I find needs critical social infrastructure, which is going to only increase. And with what's happening right now as we speak in the Bay of Bengal, the need for health services is only going to increase just within the next few weeks as a minimum, right? So I'd love to continue this discussion offline. There are a few things that I have in mind, and there are a couple of potential investors I'd like to introduce you to, actually, who may have a particular geographic focus and can better understand the risk premium that most people apply in a market like Bangladesh.
Wonderful. Thank you. Thank you so much. Great to meet you as well. Looking forward to continuing to chat.
It's not a table pounding yes from me either, I'm afraid, but I love it. I love what you're doing. And I love the business model, and I love the way you're thinking about it. And I'm thinking about building out units around a central hub makes a lot of sense, because you'll get a lot of efficiency with driving more revenue from thinking like that. So I love it. It's out of my geographical normal reach, but I'll absolutely look at it some more. I'm not limited by where we invest. I'm happy to explore it more and look at it more.
Wonderful. Well, thank you all so much. It's great meeting you, and really appreciate everyone taking such an interest in asking such thoughtful questions and sharing your perspective. Thank you.
Thank you for presenting today, Silvana, and wish you the best of luck in this round of fundraising. Just to let everyone in the audience know, we have a poll going on with the question, would you invest in PRAAVA Health? We'll announce that poll in a little bit, but please feel free to vote. Now over to the next presenter while we're waiting for that. Lucy, are you ready with your presentation? Oh, I think you might be on mute, Lucy.
Okay.
Oh, there we go.
Yes, hi.
Welcome to the show.
Thank you. Let me share my screen.
Okay. While you're doing that, why don't we show the poll? As you can see from the poll, we have a broad spectrum of results, or broad spectrum of interest, ranging from the middle area from 10 and 25K to beyond 100K. So congratulations.
Sorry, where do I see that? I can't see it.
I don't think it popped up,
Nope.
Jim.
It didn't pop up.
Oh, there it is.
There you go.
Oh,
Now.
cool. Great. Great.
Yeah. So
Awesome.
congratulations on that. And we'll move on to Lucy with your presentation.
Hi, ladies. Hi, Jim. Thank you. Yes, you can see my screen?
Yes, we can see your screen.
We can still see the poll, Jim.
Great. Okay. My name is Lucy Njuguna. I'm the CEO and co-founder of Nurse in Hand Emergency Response. Now, we're in the business of saving lives. A little bit about myself, I'm a health systems specialist. The reason why I'm doing what I do under Nurse in Hand is a few years ago, I lost one of my brothers to a motorcycle accident. And I've always had this question at the back of my mind that had there been help, would he still be alive? And we shared these sentiments together with my team of 15 members who have also had their own experiences in the accident space. And therefore, we decided to put together Nurse in Hand emergency response to change the narrative, not just for ourselves, but for other families. So Nurse in Hand emergency response is first responder service in Kenya, offering accident response to passengers who are our customers. Now, the screen that you can see, this is a normal occurrence on our Kenyan roads. Accidents happen on a daily basis. And as you can see, when accidents happen, everybody moves in to help, whether they know what they are doing or not, but there's that pull to go and help, pull out people who are injured. And this ends up killing some people who should not have died, or making the injuries worse because they're not professionals equipped to do this. So according to statistics in Kenya, we report 3,000 passengers die every year. And also according to recent statistics, 5.6% of Kenya's GDP is lost annually due to accident incidences. When we looked at this, sometimes the people who want to help look on, they may have good intentions, but they're not well equipped. So what we did was we developed our solution, and we looked at how can we equip the people who want to help on a technology that would be able to support the response or road accident response. So we've developed two apps, and one app is downloaded by the citizens, so they can be able to alert when they see accidents instead of moving to the scene of the accidents and helping, yet they're not trained to. And the other app is for emergency providers. And here we have our own paramedics. All these alerts are then picked at our control center, and also they're also routed to our roadside emergency centers. So as you can see, that is our control center, and these are the two mobile apps. Now, alongside the highways, we have our first emergency roadside center that's completed. It was to be commissioned just before COVID, and I am there, as you can see. So we are so proud of this first center. Now, our paramedics are dispatched from the emergency roadside center to the scene of the accident on emergency motorcycles, and they go carrying emergency medical supplies to the scene of the accident, and they manage the scene of the accident, just changing the earlier narrative where everybody gets there. And they're able to stabilize the injured, and then as we wait for the ambulance providers to come to transport the stabilized accident victims to partner hospitals. Now, for our paramedics, we expect them to carry all these gadgets on their emergency motorcycles to make sure that we effectively are able to save the lives, okay? Now, our market, our entry to market, we are focusing on the Northern Corridor Transit route. This is the main highway that supports most of the vehicles in Kenya. This highway starts from the port of Mombasa and onward to other countries like Uganda, Rwanda, Burundi, and Central Africa. So in Kenya, this Northern Corridor Transit route covers a distance of 1,700 kilometers. And we're starting with a pilot phase of 200 kilometers west of our capital, which is Nairobi. We have collaborators in this journey, and these are ambulance service providers, hospitals, insurance service providers, and the government. Our traction, we started back in 2017, where we thought through the whole concept on how to work. We engaged government agencies to allow us to deal with this. And we've had very good partnerships with private sector, public sector, and also government. And in 2020, we've managed to put out our first emergency roadside centers. The land was donated by one of our partners, and this is our first center. As you can see the outside with some of our members, and that is the interior. For us today, we are looking at being able to buy 10 fully kitted emergency motorcycles at a cost of $10,000, and this will total up to $100,000. That is part of the team. We have a mix of mostly doctors and others who have different skill sets. Our partners, we have partners in government, private sector, public sector, and others of who are our advisors. Thank you.
Thank you very much, Lucy, for a great presentation. Well, over to the angels.
Lucy, I have a very basic question.
Yes.
Help me understand how you make money.
Okay. We have our model, which is a subscription model, and here we focus on our on the passengers. As an entry to market, we are focusing on the passengers who use public transport. So that we have, they pay 0.20 of a dollar for every trip they make. Okay, since our rationale to that is that the probability of having an accident is when you're on the road. So we have the multiples of this. Now, we base this on the fact that a service like this, when we started by engaging government, the main agency that is mandated with emergency response was very clear that we could not start this business on donor funding. Yeah, it had to be self-sustainable. So for the last 2 years, we've engaged the passengers and also the fleet managers in the public sector. We've gone through education, plus we've also gotten to understand their pain points. And we've aligned our service with them, directing and guiding us as key partners. So in the last 1 year, we've trained 5,000 minibus drivers on how to download our app, and also accident scene management, where we train them that when they see an accident, they should not just jump out of their vehicles to go and try and save the injured, but there are certain steps they should take. One of it is just to calm down and to be able to understand that their lives in the other vehicle, and before they leave their own vehicles, to alert us. Press that alert, and this alert will get to our paramedics who are situated along the highways. And then we have a professional getting to the scene of the accident to manage and do the right thing. Yeah.
So Lucy, how many So you've got 5,000 minibus drivers who've downloaded the app for free,
Yes.
presumably.
No, they paid again
Paid to download it.
0.2 cents of a dollar.
Okay.
Yes.
Just to download the app.
Yes. Yes.
So
Yes.
you're
It's linked to our M-Pesa. Okay, that is a money transfer platform, and that was part of our pilot.
Okay, so
Since
people
when
are
it's
paying to
open,
download the app, and then they can use the app in case of an emergency. Got it. Okay.
Yeah.
Hi, Lucy. Well done. I really love what your business is doing. I look at it and I think it has very broad applicability across Africa. I would love to see something like this in Nigeria. In many of our markets, emergency services are very thin and takes time. And you're very right about that. People just jump in when they see crises, which is really good from an altruistic perspective. But if we're not giving these folks the care they need on impact on site, it's a struggle. So well done for what you're doing. I guess maybe one question from me would be around, I'm still not really clear on how this company earns its revenues. I wonder, is there any extent to which you put the financial responsibility in the hands of passengers? I know I read something in your deck around insurance. I was hoping you could elaborate that a little. As you probably noted, on the continent, there tends to be an aversion to, not aversion, but that health insurance is not fully embraced. And I think particularly when it comes to accidents, it's quite essential. So it's great that you've narrowed into that particular sphere of healthcare, but how are you thinking about insurance provision beyond the transport providers?
Thank you. We say that Nurse in Hand is being modeled in Kenya for Africa. It's actually an African solution. So as we've been thinking through these and piloting, it's not just for Kenya alone, it's for Africa. Now, in Kenya, there's one government agency that is mandated with road safety in Kenya. And that agency, which is a government agency, is able to, has managed the public transport companies into what is called SACCOs, okay? And these are registered under this institution. And this is the same institution that has recognized us as an emergency provider on the highways. So the partnership is a tripartite partnership where the government agency requires that we reduce deaths due to road accidents. And to do this, we need the minibus companies to be partners into this in terms of sustainability. So on that, we've, as we collect the 20 shillings, we are then cleared by another government agency called Insurance Regulatory Authority for us to run a micro insurance. Now, as we collect, any money collected from the passengers is then now grouped under the micro insurance. So that is our evacuation insurance cover, okay? However, once we hand over the injured to the ambulances onward to the hospitals, then we have three categories. We have those who are covered by private insurance companies. There are those who are covered by, we have a public insurance company called NHIF. And then the government recently introduced UHC, which is universal health coverage for those Kenyans who do not fall under any of either the private or the public insurance covers. So with that, we've fitted into an already existing system. And what we've done is captured our niche space, and we've made sure that as we pick the 0.2 cents of a dollar, then this goes towards helping us sustain. So every day, according to statistics, we have 80,000 public service vehicles on our roads every day. And the minimum minivan carries 10 people, okay? So, and so that is a big picture. However, we are focusing on the Northern Corridor transit route as an entry to market, which is this highway. It's a main, it's the busiest and contributes to 25% of accidents in Kenya. So already the pilot that we have done has proved that we are able to sustain ourselves. And we are perfecting our model first on the 200-kilometer stretch before we expand out to eventually cover the 1,700 kilometers. And as we expand, we're able to cover more ground and bring on board more companies, that more passenger transport companies, the SACCOs, to be able now to increase our contributions.
So I think related to that, there's a couple of comments and questions from the audience.
Okay.
One from Raj about whether the government can require all passengers to have this insurance. And another comment from somebody else that it should be clarified that Matatu companies, or the companies doing the shared taxis, are forced by law to provide emergency healthcare solutions. So could you comment on both of those?
Yes, yes. Now, as you can see our traction, we started off, before we even went to the market, we first of all engaged the government to understand whether they would be able to support us or not. And it's in the Kenyan government's interest to reduce the accidents due, not just accidents, but also deaths due to accidents. There are some of the deaths that occur not due to impact, but due to handling. So as we got into the market, we aligned ourselves well with the government to make sure that we have the government goodwill, we have the government support, we are augmenting the government service to Kenyans, okay? So we are well supported. Now, part of this for sustainability, the government was very clear that they don't have the money to support this service, much as they have given us the recognition as an emergency provider on our highways. And what the conversations we had with them was that we bring on board the public passenger service providers to also be able to be part of the solution. And with that, we looked at who benefits from our service. It's the passenger. And in the last 2 years, we've engaged passengers, and they've been willing to pay. So it's not about being forced to pay. It's about, at an individual level, realizing that when you get onto that highway, there's a probability, 50% probability that you could have an accident. Also going with the fact that when we have troubles as Africans, we happily even donate blood, and we have no idea who that is going to. So it's about taking a responsibility in partnership with the government. We are regulated by the government on that. Sorry, what was the other question?
whether that whether it's compulsory for Matatu companies to have some type of emergency response.
Okay.
On that.
One of the things that we've done in the last 2 years is to go into the Matatu space and engage with them, understand their pain points. And they also got to understand the value or the benefit that they stand to gain by supporting us. So it's not about being forced, it's about understanding where do we support them or solve some of their pain points. Now, according to the NTSA charter, that is the road safety agency, all matatus are required by law to subscribe to emergency response provider. Now, I'm happy to say that at the beginning of this year, we were also recognized by the same agency as also an emergency service provider on Kenyan highways.
So that's congratulations on that.
Thank you.
That's an important point to clarify. I think if those companies are required to have this type of service and you're offering that type of service, I think there's some potential market growth for you. Any other questions from Gita, Sarah?
So Lucy, congratulations. This much of what I've heard you speak about today has helped me make sense of the document that you've already submitted. One of the things I love about the approach you've taken, not the model yet, but the approach you've taken is you've approached it from a community perspective. Healthcare on our continent is a community based approach. Otherwise, it becomes so transactional, you squeeze out who can actually afford your services. And it looks like you've spent the first 3 years of the life of this business actually building up those relationships, whether that's with government and post the devolution of government. This just means that you're having to form what I presume are bilateral relationships with counties. And I know there's a lot happening in Makueni County from a healthcare innovation perspective and other places. The target that you have in terms of specifically identifying, look, road accidents are one of the leading causes of death on the continent today. Literally, it's the one thing all of us are terrified of when we get onto a road, regardless of which country we're in. And the ability to look at that health ecosystem, recognizing it's hard enough having access to an ambulance, much less having emergency care, which is going to be provided on site if there is an accident. So I see a very real need for the service that you are offering. I would love to take this offline and have a conversation with you. This is a very interesting business for me. I have two quick questions. The first of which is, I see you've been knitting together multiple solutions, because as we know, you can come with a good healthcare solution, you still need to figure out how people are going to pay for it. And so I see you bringing the microinsurance and so forth. I'd like to understand, the summary you have at the end of your deck talks about 3 services: the emergency services, the emergency and disaster emergency medical consultancy services, and the third is the training services. Could you tell us a little bit about the customers that you're seeing for each of these, or you think would be your customers? And what are the returns you think an investor should be expecting from investing in your business, and over what duration of time?
Thank you. What we looked at was the different ways of ensuring that we're able to sustain this service. So once you're on the road, we are not getting the paramedics off the road. That is one. Secondly, we needed to make sure that our stakeholders, be they the public circle managers, the managers, the drivers, the touts, all understand that we've got to work as a team to make sure that we're able to offer them an efficient service. So there's a lot of training, and you'll be surprised that when we got into that space, we found that training is not anything new we're introducing into the Matatu space. They've been doing trainings, first aid trainings, customer care trainings, they've been doing that. So the training we brought into their space is the accident scene management. What do they do when they see the accident? And also equipping them with the tools like the mobile app, where they're able now to be better equipped and not just to go and deal or do what they need to do. They told us, as we've been training them, they've told us horrific stories where when people are trapped in the vehicles, they go there with all sorts of tools, yeah, axes, pangas, okay, to try and get the people who are trapped out. And you can just imagine when that axe misses, okay, it lands on the person they are trying to save. So there has been that training, and we found that this is not anything new. They are ready to pay, okay, for our trainings. And also we looked at second phase would need now to engage the public, who they are the private citizens who do not use matatus, okay? And you realize that making our roads safe is everyone's responsibility. But the question is, how do we all even support our government to make sure that they are able to deliver that service with NAS in hand and other stakeholders supporting and augmenting the government service? So that will be now another level of training, where we also had companies showing a great interest, where they would also want us to engage with their employees. Because at the end of the day, when those employees get onto the road, the statistics apply to everybody. So we're looking at those different avenues of sustainability. Now,
sorry, Lucy, I'm not sure if I caught this, but what was what was your revenue for the last year?
Okay, we started, for the last 1 year, what we've been doing more is on piloting, okay? And we engaged one of the stakeholders who has 100 buses. And we did our market validation. Every day we had the 100 buses on the road with a passenger capacity of 34, and they ran every day of the week.
Lucy, do you mind putting the key metrics slide back up? I think there are a number of people in the audience who would like to see some of those metrics and also your ask again. And you can please continue with what you were saying. There you go. Thank you.
Yes. So as you can see, the business metrics that we're referring to that particular client, where we're able to engage with the bus company, where they carried 33 passengers in a bus, and they have 100 buses. So, and here we're working with still the 0.20 cents of a dollar, okay? And we're able to peak $17,160 per month. And for the 8 months that we peaked with them, or we piloted with this particular company, we're able to have an accumulated revenue of $137,280.
And so if I understand correctly from the slide, that so your churn rate is 0, meaning that you're already past break even. Did I understand that correctly?
Yes. What we did was we have been very deliberate in terms of onboarding our customers, since we do not want, we're using a push and pull in terms of engaging with our stakeholders or with our customers. And we are very careful, since we do not want to lose any one of them. We want, once they're on board, they well understand the responsibility they also carry by the fact that their cargo is human life. So we've, as part of our market validation, we've worked with this one company. It's quite well organized. And as we also have the conversations with the matatus, so we find that the buses are more organized and readily on board and pick for us the 0.2. In fact, they told us that they thought that the 0.20 cents of a dollar was too little for what we want to achieve. But we said, as we start, we need the customers also to enjoy the service we're offering before we can ask for more. So, yes. So that was.
I think Geeta had a question. Geeta and Raj, in fact.
Yes, Raj and I have the same question.
Yes.
And this is really about the device. And you've mentioned two devices. One is actually a wearable. The other one is something which is fitted in vehicles from which an emergency alert can be sent.
Yes.
Is it possible for that to be something which is installed on your phone so that there's not a separate device?
Okay, we're looking at different options. When we introduce the wearable device, we're also having in mind the motorbike riders, okay, who also contribute or get involved in many accidents.
Are you talking about boda bodas, or are you talking about?
Yes,
any
the boda bodas. Yes, the boda
motorcycle?
bodas. Yes, the boda bodas. And we also have been in their space and had this conversation. And most of the times, you know, when they get into the accident, they are so badly broken. And this wearable can be alerted by any of their colleagues. And this would be able to give us the details of the person who's wearing that, and we can be able to still get them, since all our devices and also our mobile apps are on Google Map. Yeah.
Okay,
So,
and do you feel you can't get that same optionality with an app on a phone?
that is an option. Okay, we're looking also at that being an option. If one wants to have the wearable, then it's available. If they want to have the app in their mobile phone, again, because for us, they serve the same purpose. They alert us.
Okay.
So those are just options. And also the fact that we're quite interested in looking at the latest gadgets in the market and how we can make them available to the bottom of the pyramid, you know? Yeah, so.
Great.
Thank you.
Well, we're running a little bit short on time. So are there any other comments or questions from the angels? If not, then I'd love to hear responses from the angels about their interest in this investment. And I should also note that there is a poll out right now for the audience.
Thanks, Jim. Lucy, great job again. Again, love this model. Think it has really broad applicability. I'd probably like to speak to you a little bit more offline. There are certainly still some aspects of the business model and its revenue potential that I don't fully see yet. So happy to take it offline, but definitely very well done. I think if we can get, you know, I think you need a lot more visibility with this type of offering across the continent. Honestly, it's so important. So well done. And thank you. I'm sorry that you lost your brother, Lucy, but I'm very grateful to you for taking a tragedy and turning it into something that can be helpful to others. Well done.
Thank you. Thank you.
Yes, I echo that, Lucy. It's people like you who change the world, who take their sorrow and take their pain points and actually do something about it and try and transform something that's not right in the world, and that's exactly what you're trying to do, which is very admirable and an incredible thing. So very, very well done. Very impressive, all that you've achieved to date with very little dollars invested. It's super, super impressive. And you're making progress with getting users on board every single month, which is also really impressive. For me, you're not quite at the point where I could invest. The unit economics are not quite buttoned up as much as I would want to see them, with a clear path to sort of really being able to scale and really understanding how the business can really drive revenue. And of course, driving revenue from healthcare is tough because it's effectively a social enterprise. So it's a little bit too far out of my wheelhouse, I'm afraid, but I commend you for your vision, and I know you will find a way to make this work.
Thank you. Thank you.
Lucy, this is totally in my wheelhouse. I really appreciate what it is that you've done. You've spent 3 years, and I can't imagine it is easy, because you are working with some of the most challenging elements of the health ecosystem, from dealing with public sector to also, by the way, negotiations with matatu companies is not easy by any stretch of imagination. And I know there's been a lot happening in the last 6 or 7 years, especially in Kenya, as UHC has been planned to be rolled in. And another aspect of that is obviously getting the insurance fund off the ground. So I feel like you've put in a lot of effort already, and I would love to have a conversation with you offline about this business. I am very interested.
Great. Thank you.
Thank you, Three Angels. And even though I'm not on the panel, I would say that similar to Sarah, I'd love to see more of the business evolve and the unit economics, and I'd love to see if there's any way that Untap can help you in developing the business model further and raising a more significant round, because I think, as everyone has said, what you're doing is fabulous, and the fact that you've gotten there with so little is truly impressive. So if there's a way that we can help, we'd love to.
Thank you. Thank you.
Thank you, Lucy, for the presentation. I'm going to show the poll. We have a great poll from the audience.
Okay. Thank you, ladies. Thank you, Jim. I
We
appreciate
have quite a broad range. Some folks in the middle. No large amounts committed, but we do have some in the middle. So congratulations, Lucy, for the presentation and for all the work you've done so far.
Thank you. I appreciate it. Thank you.
Thanks, Lucy.
Now on to Derek. Are you ready to present, Derek?
Yes, I am ready to present.
Great. Well, then, love for you to share your screen, and then the show is yours.
Okay, my name is Derek. I'm the founder and CEO of One Lump. I come from Uganda, where I grew up from a community where most people do not have access to the grid. According to the World Bank, Africa needs about $300 billion to be able to achieve universal electricity access by the year 2030. Unreliable power supply has been identified by African enterprises as the most pressing obstacle to achieving business growth. One Lump provides digital energy financing for large productive solar appliance systems to women-owned SMEs that lack access to the national grid in Uganda. Why women? Credit gap for women-owned SMEs globally is 287 billion, and up to 70% of the women-owned SMEs lack access to financing that they need to grow a business. 90% of One Lump clients are actually women-owned SMEs. Our target customer segments include local retailers, restaurants, dairy farms, and small businesses that are based in rural and urban areas. A complete solar system for dairy farms includes a freezer of 402 liters, 2 solar panels, each of 300 battery. A retail solar system includes a solar display fridge of 280 liters and 2 solar panels, each of 325 watts, as well as LED lighting. Now, for small restaurants, One Lamp does provide portable gas cookstoves, as well as solar kettles that can be used, to boil water, to boil tea for customers. Now, One Lamp has partnerships with global suppliers, and our lithium batteries and solar panels are supplied by Omnivoltaic. The DC solar fridges are supplied by Togbo, that is based in China. All our solar products are sold with a 3 years warranty, and we do the delivery and installation of these systems to ensure that quality jobs are done. How does One Lamp make money? We do generate our revenue as you go model. Our customers make an initial down payment of 10% of $300, and then they will go ahead and start making weekly payments of $28 spread over 2 years. Our digital credit terms are designed to match additional cash flows that are generated by the productive solar systems for the SMEs that we do provide. We market our solar refrigeration systems with a focus on the long-term productivity, the extra income that is earned by the SMEs, and the extra jobs that are also created. On the solar systems for retailers, we do have a gross margin of about 34% and a net margin of 27%. Now, on the gas cookstoves that we do provide our restaurants, our small restaurants, we do have a gross margin of 61%, a net margin of 59%. So basically, all our pricing covers all our direct and indirect costs. And we do break even by the end of 2 years after customers have completed payments for all the systems. How does pay-as-you-go work? One Lamp partners with MTN and Airtel, mobile telecoms in Uganda, to be able to enable payments from customers. So the first step that our customers do is to deposit the initial 10%, and then the system is delivered and installed. After that, the customer has to make a monthly initial deposit to be able to use the system after 30 days. When the 30 days elapse, stage 3, the system locks and the appliance stops working. Stage 4, a customer has to make payment, and then the system will be unlocked for another duration that has been paid. The code, a 12-digit code, is sent via SMS and is entered into the lithium battery, and the system is activated. So after One Lamp receives payment for 24 months, the entire system is unlocked, and the customer takes full ownership with extended warranty. I will say again that we provide a 3 years warranty. So customer pays for 2 years, and then they have an extended 1 year warranty after they have completed their payments. We are not alone in this industry. There are very many other players that I know some of you know them: M-Copper, Solar Now, Greenlight Planet, D-Light. All these are players in the solar industry, and they have also started doing pay-as-you-go. Now, the biggest difference between all these players and One Lamp is our focus on productive large solar systems. One Lamp, we are really focusing on productive use of solar energy. So for us, we are not after just doing lighting and mobile charging. We are beyond that because we do believe that to end energy poverty, we really have to make sure that the people that are affected most actually can make money using these systems that they are buying. Since 2014, we have managed to set up one regional customer service center for Eastern Uganda. And we have also a direct sales force network of 520 local retailers that we have trained and recruited. One Lamp receives orders via SMS, and we dispatch a solar system. Our technicians do install systems, like I said earlier on, and our regional customer service center handles all issues that arise, whether it is troubleshooting products, whether it is replacements, all that is handled via our customer regional service center. What is the market? According to the World Bank, the global market opportunity for solar refrigerators is valued at 12.6 billion by the end of 2018, and is expected to grow to 25 billion by the end of 2030. So this is a very huge market, and in sub-Saharan Africa and in East Africa, it's still nascent. In a country like Uganda, we have only 3% of the population using light solar home systems, even if a total of about 350,000 systems have been sold to date. So there's really huge potential to grow, to scale in East Africa and also the entire sub-Saharan Africa. Like I said at the beginning, that we started operations in 2014, and we've been growing steadily using our organic revenue. So from the 50K that we actually managed to make in 2014, we project to grow to $5 million by 2025. Now, to be able to achieve this kind of growth, our focus is really women-owned off-grid SMEs. And we plan to onboard a target of 6,000 SMEs by 2025. Now, 6,000 seems really small, but this number will give us this growth because our unit costs, we have a huge gross revenue margin, and also our products are sold at $3,000. So I know the companies out there, solar companies that want to achieve 1 million households, want to achieve, really crazy numbers. But for us, our numbers are really that small because we know we can deliver a quality service, and we know our customers will be able to pay for this. Now, as a clean energy business, access to to solar homes, to solar refrigeration systems increases digital financial inclusion for our customers. It also improves productivity by up to 40% for the women-owned SMEs, and it also increases income. Because there are extra income generating opportunities that are created, whether it is packing juice, whether it is freezing milk. So because of these extra income generating opportunities, we do see a lot of potential for social economic growth. Now, One Lamp has a full-time team of 28 people. And this team is compensated with a mixture of salary and commission. Our executive teams have experience and skills cutting across sales and marketing, finance, HR, last mile distribution. We also have an experienced advisory board with the representatives from Lighting Global. Some angels could be knowing Leo from World Bank. We also have representatives from Deloitte and Visa that have really helped us since 2014, 2015 to grow this business. I do believe that we have set a strong foundation to be able to scale this business. Today, One Lamp is requesting, and we're asking for an investment of $100,000 from angels. Using this investment, we do believe we shall be able to improve our monthly recurring revenues from $22,000 to an average of 65K. We also hope to onboard 200 off-grid women SMEs weekly, and also to be able to impact 10,000 off-grid SMEs by the end of the year. This is all I have.
Thank you,
please
Derek.
ask me questions.
Fabulous results for being so young in the organization. Congratulations. Yes, over to questions and comments from the angels.
Thank you so much, Derek. Thank you very much, Derek. That was great. I personally really love what you're doing. I think it's a fairly simple business model with great applicability. And of course, you said the magic word. You said women-owned, which I think triggers something in many of us. I love that that's the market that you're targeting. I'll just say two quick things. I mean, one of the maybe unintended consequences of this business that I think is fantastic is, you know, you're actually collecting quite a bit of credit data. And credit data is gold these days. We need to build that, certainly in the smaller segments of our African economies. So I would hope, and we can always catch up later and chat about this, but I would hope that you are working to meaningfully capture that data, because what you're getting from that, you know, you are not only providing solutions for these businesses, but you're actually enhancing their credit worthiness. And as a result of having used your product, they can go and get some more formal financing from the banking sector and other financing options on the basis of the credit that they have generated with you. So well done. I love the business. I think it has broad applicability, and I'm not even going to wait for Jim to ask if we're going to invest. I would certainly give you some money. It might not be a ton, but I would certainly love to support this. So well done.
Thank you, thank you, thank you, thank you, thank you, thank you.
Wow, great, fabulous. Geeta, Sarah?
So on your side, Derek, I will definitely have a few more questions. I find this really, really interesting. A couple of questions I have, and I'd love to just get your perspective on this. The first of which is, you've differentiated yourselves from some of the other players who have become quite big in the region, and D-Light is big in more than just the region and have been around for a long time. Mkopa has been around for over a decade, but then it's taken a very long time as well for some of these businesses to even break even. And so it's been a case of building the business through increasing and increasingly significant, increasingly frequent and increasingly significant rounds of financing. So I'd love to get a sense from you in terms of what happens if they decide to move away from focusing on the individuals and the household to focusing on businesses. How defensible is your product?
One of the biggest challenges with off-grid customers is it is very difficult to move customers once they have started on a journey with a company. So one of the things that Mkopa and Greenlight Planet and D-Light have realized is that if a customer has been convinced to buy a product of 4 lights, and you know, the capability to charge mobile phones, that customer cannot be convinced later to upgrade to a product of $3,000. So I think for us as One Lamp, that our customer segments that we're really running after in this market is totally different from what Mkopa, from what D-Light, from what the other players are really running after. For us, we're not running after those. So even if Mkopa right now says they are going to do what we are doing, it is going to require a lot of change. It is going to require a lot of, Mkopa, for example, at the beginning, they were not doing production. They're now doing production. So all that has to change. And the customers that we also now guide and onboard and get are also committed to one number. If we introduce, let's say, a new product, a solar kettle, or a solar, let's say we are going to introduce a solar washing machine, because already one of our suppliers in China does manufacture DC solar machines. And let's say we are going to, that's a business, totally, a very good business for people who do dry cleaning in Uganda, because, you know, they're using charcoal iron passes to guide and, you know, run their businesses. M-Corp cannot shift that to that client. So I think for us, the biggest strength that we have and differentiation is really understanding the customer we want and the customer that, you know, is going to make us scale. I think it is a strategy that we are proud of. It's a strategy that we can defend. It's a strategy that is profitable. It's one of the reasons why M-Corp, even if they've received tons of money, they have not yet broken even. They are scaling right now to West Africa. I think they're now in Nigeria. And the biggest reasoning is they are really selling products mainly for lighting and mobile charging. And these products are not earning any extra, are not earning households any extra money. Our biggest differentiation, our strongest strategy is really our customer segments and our products.
Thank you for that, Derek. There's a related question to that from Raj Gulasingham. One of the concerns I have in the market, he writes, is the amount of grant money that there is in it, which skews competition and doesn't identify who the real winners are with proper economics. How do you see that issue affecting you?
I think one lump, since 2014, I think the only grant I will say as a business that we have received has been from Power Africa, has been from Power Africa, United States African Development Foundation. And this money was really not to buy products. This money was to guide and scale our sales force, our sales force. So I think regarding grants, what is the purpose of the grant to the business? If a solar business is going to receive grants to manufacture products, they are going to distort the market. They're going to distort the market and big players in the market. So I think the issue of grants, it's a double-edged sword, depending on how the business receiving the grant is going to use it. I will note, we are not against grants, but I think it really goes back to what that grant is going to do. There is an organization some time back that was started called Sunny Money. And Sunny Money, I think, in the solar industry, raised tons of money. And what they were doing, they were buying solar lanterns, and they were just giving them, they started by giving them away, to schools. After giving them out to schools, they realized that it is not really sustainable as a business, and then they started, to sell them at a certain reduced cost. But even that was not sustainable, so they really had to stop that entire business. So I think that would be my response regarding grants. That grants are not bad, but what are they really doing for the business and in the market?
Very clear. Angel, Sarah, did you have comments, questions?
I love this space. Currently working with another business in Zambia in exactly this space. So I know this business model very well and understand how this works and the potential pitfalls and the potential sort of wins for this kind of business. I love the fact that you are differentiated by focusing on a commercial customer with commercial products. That's very unusual in this space. Everyone's typically focused on the small scale solar unit for lighting and charging phones. So this is really interesting. Obviously with a more expensive product and therefore potential to generate more revenue and more margin overall. I'd be interested to know what you've learned so far about your default rate. And how obviously you have a win in that you can turn the power off with these products when people don't you know, if they don't pay you, they don't have the use of their piece of equipment. But what have you seen so far, sort of statistically, with delinquencies?
So regarding default rates, one number has had less than 5%, and we had. Hello, can you hear me?
Yeah.
Yes, we have had less than 5%, and we ended up remodeling the entire business.
Well, I guess we have some challenges there on the internet side for him. While we're waiting for him to come back online, let's go ahead and launch the poll and give people a chance to vote while we're waiting for him to come back. Hopefully he comes back. Well, so we might not get Derek back on this, but while he's out there, well, I would just like to propose potentially that hopefully he comes back. And this is a little bit behind the scenes under the table, but personally, I'm in. I think this is squarely in line with what we do at Untapped. We'd love to be a major financier of the CapEx for him to scale out and really truly scale so we can go after the big guys. And I would just say to the other angels, while Derek is not here, and trust me, I didn't kick him off on purpose. Let's put something together and let's finish off his round and let's get him to scale. I love what he's doing. I love the fact that he's gotten so far with so little and that he has a young and clearly motivated team. So I'm happy to tell him that when he comes on. I have to hear everyone's additional responses, but that's my positioning on this, even though I'm not on the panel.
Jim, I'd like to continue the discussion definitely on this one. I've got some questions because there's been a similar business in a portfolio that I've been involved with before. And so I'd just like to be clear on how they're addressing some of those challenges. But I think this is really, really interesting. I would also be curious, and maybe now is not the right time, maybe at the end of this session, but I want to just put a question out there to get some feedback from you. And some of the others. I was curious, as you said, we were the first all-female panel that you've had. And I'm curious to understand whether you feel, having had a series of these discussions, that made a difference, either in terms of the selection of the feedback or the engagement with the entrepreneurs. But happy to cover that at the end of this session, and really coming from a point of curiosity.
Yeah. Well, I think well, first of all, everybody on the show has been quality investors, as everybody on this panel. And so from the questions asked and the engagement with the entrepreneurs, I don't see a huge difference there. I think I do see a greater focus on collaboration and community, which I truly appreciate. And I hope to have further in the future. That doesn't necessarily mean we need to have an all-female panel to do that, but I think having more female investors as part of the show, as entrepreneurs as well, and certainly for every single show having at least one or two female panelists, I think will make a big difference. So all I can say is I will need your help in identifying and reaching out to some additional investors so that we make sure we have a good flow coming on the show.
Oh, fantastic. Really appreciate that feedback. And I think you'll find that we know we're few of few. And so we're always happy to honor and recommend, and equally really appreciate the fact that we had female entrepreneurs as well. And so looking forward to seeing that pipeline maintained as you get the nest even more successful than it is right now. Thanks, Jim.
And hopefully we'll get your help on identifying good entrepreneurs as well, female entrepreneurs as otherwise. Well, I don't think we will see Derek back, and looking forward to congratulating him on a good presentation. I don't know, Sarah, did you have any additional thoughts? We are being recorded, so hopefully he has a chance to hear this from you, at least via recording.
Yeah, Derek's presentation was excellent. His ability to clearly communicate his numbers was really, really great. You probably sick of hearing me say tonight. I'm interested in the numbers, because I always expect entrepreneurs to be passionate about their business and that their business is, valid in today's world. So I'm always interested in great numbers, great entrepreneurs, and great unit economics. So he did a great job. As I said, I love this space. It's super interesting, and I'm super interested by the fact that he's working in a slightly different segment than you see most solar providers. So I'm definitely interested to learn more about his business for sure.
Sounds great. And Maxime has proposed online. Does anyone from the Nest in the audience want to participate in this round? If there is, please let us know. And what Maxime and I will do is put together a call where we can go through a little bit more due diligence on Derek's current round and hopefully be able to give him some good news. Derek, welcome back. We have some good news for you. Can you hear us, Derek?
He's on mute.
He's on mute. Okay, let's get him back.
Yes.
Can
you hear me? Can you hear me
now? Yes. So while you were gone, I think there was a lot of excitement among the angels, and what we are going to do is get back together with you as a group and help you with a round of investment. We hope after some additional questions and due diligence. So congratulations.
Thank you so much.
Congratulations on achieving so much with so little so far and putting together a fabulous team and with fabulous results. Just a note from my side is I think aside from the potential equity investment or investment in convertible note, I think from an untapped perspective, because we are focused on asset financing, you're exactly the kind of business that we want to work with. We want to help you scale up with an unlimited amount of capital, CapEx capital, so that you can sell as many of these units as you can. So
thank you.
Let's work together on that. Uganda is one of our target geographies, so very much looking forward to working with you. Any other final comments from the audience or the angels?
Just well done again to Derek and his team, and Jim and Maxime. I wanted to thank both of you for pulling this together. You're really giving an opportunity to entrepreneurs, and you're giving an opportunity for us to just showcase what we can do in emerging markets. So well done.
Thank you very much. Thank you very much. And I just want to say thank you to all three of you for being on the show. This was a particularly long session, and in the future we're going to have 2 presenters instead of 3 so that we can spend quality time on each of the presenters, but make sure that we don't kill everybody with Zoom in 2 hours. For entrepreneurs, if you are interested in presenting, let me share my screen. Please go to findthenest.org and you will be able to apply via WhatsApp online by sending a short video of yourself and answering a few questions to that number via WhatsApp. And if you're an investor or otherwise interested in investing in frontier markets, please hit me up, look me up, send me an email. That's what we're here for. And I hope to see you on the next Nest next week. Have a good day, all. And
Bye-bye.
Bye. Bye.